Hey, I'm K Hixon, and I'm here with
Christopher Kirkman.
from Williamson Health, and we're going to start out today by talking about NAEMT Code of Ethics. So, Kirkman, are you familiar with or have you ever heard of the NAEMT Code of Ethics?
No, I'm not. I've never heard of the Code of Ethics, even with all the NAEMT courses I've taken over the years.
Okay, so if I said, could you recite any of the main points or remember anything about it, we couldn't have that conversation.
No, we could not.
Okay, so I'm gonna pause the video. We're gonna look it up, and then we'll be back. So we're back after reviewing the NAEMT Code of Ethics together, back with Chris Kirkman. So he described earlier that he had not heard of the NAEMT Code of Ethics, and we're going to talk about that a little bit. So I'm going to let him share his experience from not knowing about the Code of Ethics and maybe why or things he had experienced with that.
So looking at what the EAEMT has presented, that format was never, I've never seen that in my career. I'm a graduate of Eastern myself from many years ago, and one of my instructors actually sat on the board of the NAEMT. And while that idea and what the ideas that were presented were there, they were never in that format. So being the first time that I've seen this, it just makes me wonder, the values that are listed are good. They are what practitioners need to use on a daily basis to ensure best patient care, best possible outcomes. I think it reflects to the character of each provider if they follow those rules to the letter.
Right. I just think maybe a lot of people haven't seen them in that format. I think they're probably guidelines or principles that we all use, but maybe people haven't seen them presented as the NAEMT Code of Ethics. I think they're just things that generally people know or think are correct. Or
I would agree to that. In the EMS you have this situation where it's you and someone else. A lot of your patient care is unwitnessed. A lot of your clinical decisions are unwitnessed. Things like medication administration, when you have controlled substances, there's no one there to, verify that you actually gave that. There's accountability for disposal, but anyone that's worked in the field for any amount of time knows that that's easily solved. So it comes down to having a good character and just knowing that your professional career and that what you do on a daily basis impacts not just you, but also the outcomes of your patients and those around you.
Okay, so let's have a little conversation about what EMS leaders should or could do to increase the knowledge of the code.
I think that leadership in EMS takes a lot of dedication. It takes a lot of trust. As I said before, a lot of your clinical practice is based on what you do between two people. And what leaders can do to help that is to support those values. And then whenever they see that in the field, when they have a positive example that relates to the code and supports the code, you can commend somebody, be like, this is what we stand for, this is what we do. And additionally, when you look at people that are deficient in the code, I think a lot of that is how you approach that situation to correct that deficiency. If you notice somebody that isn't documenting something appropriately or has a clinical issue, you need to go through and address them in a professional, private, correct manner and try to correct it.
So maybe recognizing if someone is following the code to the letter, recognizing, hey, this is what the NAEMT Code of Ethics is, and helping them recognize that they're following that code to bring more awareness to what it is, so that maybe more people recognize that it exists and what it is, and then that kind of becomes a tribal knowledge versus maybe people who haven't heard of it.
I agree.
Okay. I'm K Hixon, and I'm here with Grant Rutherford from Williamson Health EMS. So, are you familiar with the NAEMT Code of Ethics?
I am vaguely familiar with them. I was an instructor with the NAEMT in a few classes for several years and used the Code of Ethics to discuss different aspects of them in the classes that I taught.
Okay. Can you recite any of the points of the Code of Ethics if you remember them?
So not verbatim, but I think the spirit of them, we should always provide the best patient care that we can. We should do everything in our power to benefit and help the public. We should present ourselves professionally in all manners of our job.
Okay. So we're gonna pause real quick and look at the Code of Ethics, and then we're back after looking over the Code of Ethics. Even though Grant was pretty familiar with it, he just kind of refreshed on some things. So, why do you think that the Code of Ethics is important to the EMS profession?
So I think after reading through them, I think the Code of Ethics could be a great tool to use in leadership development, to use in just developing our providers even at a street level, to help give them some guidance and guide rails, things to think of while they're performing their duties of this job.
Okay, so how do you think we as leadership could increase the awareness or the knowledge to crews of the Code of Ethics?
So I think we could definitely communicate those out, and I think that reading through the different bullet points or lines in the Code of Ethics, I think it would be really impactful as we're developing training and classes that we teach, that we can include some of those points and expand on those, especially as we're doing leadership development training with our upcoming staff. We could use those truly to build classes around each of those points to help in the leadership development of our staff and crew members.
Okay, I'm K Hixon, and I'm here with David Morphus.
Hello, I'm David Morphus. I'm a district chief for Williamson Health EMS.
Okay, so David, have you ever heard of the NAMT Code of Ethics?
Yes.
Okay, so when we're talking about the Code of Ethics, what would be the most memorable or your favorite part of the Code of Ethics?
Probably to providing professional competence and striving for clinical excellence.
Okay. So since you're familiar with it, you're already familiar with the Code of Ethics, how do you think we could increase staff awareness or ensure that staff are knowledgeable of the importance of the Code of Ethics?
I think probably the two big things I can think of is probably just positive reinforcement. When they do something like this that stands out, or educating our frontline staff that are interested in becoming leaders. That's probably it.
All right, thank you.